Let's look at our recommended first aid kit. As you can see, the kit comes with a lot of equipment. Let's unpack all of this equipment and have a look at what we have. Now we only really need one of each item to look at, so let's get rid of all the spare equipment. Let's rearrange everything so it makes a bit more sense. Now all this equipment comes in a lot of packaging. The packaging is there to keep it clean. So let's take it out of the packaging so we can have a closer look at it. So let's now look at each of these items. So our cotton wool here is used to pad a splint. A lot of people use this incorrectly. They use it to clean wounds. Cotton wool is very fibrous and it gets easily stuck in a wound. So the only reason you actually have cotton wool in a first aid kit is to pad a splint to make it more comfortable. These splints are very nice in that they connect together to make longer splints. You can also connect them together at right angles for use on elbows and ankles. And the cotton wool is just there to pad the splint to make it more comfortable. For example, if I was using it on my arm, I might do something like this. Where I unroll the cotton wool, place it on the rigid splint, and then I could put my arm on top of that. And the cotton wool makes it a lot more comfortable. We have a neck collar for use on an injured neck. Then we have a space blanket. This is folded up. This is a space blanket. It's folded up. If you were to unfold it, it would make a very, very large 2 meter by 1 meter blanket that you could then use to cover your patient to keep them warm. We have a burn dressing here. Inside here is a sponge that's covered in a gel. So after you've treated your burn, you can then cover the entire burn with this gel. Say for example I'd burnt my whole arm here. I would need one piece to go over there, another piece to go over there, and then I could bandage it up. We also have a CPR mouthpiece. This would go into the patient's mouth and we would breathe over this during CPR. We also have a notepad and pencil, obviously to take down notes on your patient, for example their sample history, their vital signs, and any other important information you need to remember about your patient. There's a pair of tweezers for taking out splinters. We have safety pins for affixing any item like a crepe bandage or a sling. Here we have a triangular bandage. If we unroll this, you will see it is a rather large triangular bandage. That we could use to make a sling for an arm, or we could roll it up to use as a small rope to tie around anything we needed to. There are some scissors for cutting. Generally we use this to cut our tape. There's two types of tape here. You have your elastoplast and you also have your hypoallergenic tape, your paper tape or transport. The paper tape you can easily tear yourself, because the elastoplast, you will need to use the scissors to cut. There's also some signs to label your first aid kits with. Normally the one goes on the wall where you write the first aider's name, kit, and then an arrow is used to locate where your first aid kit is. So for example, I might put this one on the wall here, put the first aid kit below it, and then quite simply just put the arrow pointing down. Then we're left with a whole bunch of equipment used for treating bleeding. You have gloves. These are M for medium size. I've already taken the large gloves out. There's normally a pair of gloves in each of these packages. That's obviously to keep you from catching any sort of bloodborne pathogens. There are some plasters for very, very small cuts and abrasions. We have some disinfectant, some generic disinfectant, cetramide solution. This comes pre-diluted and you can pour it straight onto a wound. Most disinfectants come in a concentrate bottle, so you have to pre-dilute them before you use them. Our sterile gauze here normally comes in a package, and we use that to dress the wound. So we would put our disinfectant on here and then put this onto our wound and then use a bandage to wrap it up. You also have a big pack of gauze, and this is the gauze that we use to clean our wounds. So we would wash the wound with soap and water, use this to get all the bits of plant and sand and everything out of the wound. Then we would put our sterile gauze on, and then we would wrap it up with a bandage. You have different size bandages. This is 100 ml, 75 ml, and 55 millimeter bandage. You would just choose whatever width you need. And lastly, we have our first aid dressings or our wound dressings. This is number 4, this is a number 3. You also get other sizes on either side, 5, 6, and 7, 2 and 1. And what this is a piece of gauze or a wound pad that is attached to a bandage. So again, if I'd cut my hand, once I've washed it and cleaned it, I could put the disinfectant on here, put that on, apply pressure to stop the bleeding. When the bleeding stopped, I could then just bandage it up, tie it off, and lastly, you also get bigger ones, like that one. Okay, now we've looked at everything inside a first aid kit. Let's put the first aid kit back together.